I'm one of those people who, when I say I'm a nurse, they go, oh, that's just so sweet, you're so sweet, so that works out just perfect for you. But sweet does not make a good nurse. Strong makes a good nurse. And I really wasn't a very strong person. And I have grown so much.
As nurses, we are there to care for patients. We are there to help people through some of the worst times in their life, and we're the constant. We are the ones that the families recognize, albeit maybe not all the time verbally, but you just know that you're important and that you're making a difference.
I have always been amazed at the kids and the families we've taken care of, and I feel that my job is to somehow make this journey a little bit more tolerable, a little bit more bearable for the families and the kids, to really look at what these kids need aside from just the medical portion, aside from just the medicine, to give them better quality of life. And you have the ability, because your patients tend to be in the hospital longer or come in for frequent admissions, to really get to know the families and get to know the patients so that you can tailor their care needs to what they need.
There was a little girl named Andrea who was 4 years old, and she was in our medication infusion room, and she could tell you every drug that she was going to get, every side effect, when the side effect was going to happen, what wouldn't happen, what would happen, and I could not get over her. I just couldn't. I was really struck by the fact that no child should ever have to know that, ever. But if they did, I wanted to be a part of that.
I wrote about a patient in my President's Pen, APON Counts, about a young man who was had hemophilia, and I'm one of the hematology oncology nurses that worked through the initial AIDS crisis. Many of our patients with hemophilia came down with HIV/AIDS, and this young man was smart, funny, just one of those teenagers, albeit rare, that was a joy to be around. And he contracted AIDS and started going through the process. And the one day, when it was kind of getting near the end, he asked me to stay after work one day. And I said, sure. You know, I figured he just wanted to chat or ask me a couple questions. And so I sat down with him and I was like, so what you want to talk about? And he goes, I want you to tell me what it's like to go to college, because I know I'll never go. And what I thought was going to be a half-hour visit turned into 3 hours. And when I was done, I came out of the room and I just started to cry. Oftentimes the nurse's role is harder because we do all the comforting and we're the ones that the patients trust to ask the hard questions. And I've learned over the years that being honest and forthright is the best way to practice.
I think APON provides such tremendous resources for nurses and how to care for the patients, the educational resources for nurses. You know, all of our foundation programs really don't just talk about the illness and the medical management and the nursing interventions. It gets into the psychosocial aspects, what we need to do for that care as well. And I think that that's a huge component of this type of nursing, is to be that support system for the family, teaching the families also how to take care of themselves along with taking care of their kids.
I was fortunate enough to be mentored 25 years ago to go to my first APON conference. And I went, I had a 4-month-old baby. I was not happy about leaving that baby, but it was one of the best things that I've ever done. When you work with children with cancer and blood disorders, it's a very small specialty. It's a small group of patients and families, and their needs are so different from so many others. And if you do not have the networking with other people who face the same challenges, you just can't make it. You really need a support system of people who understand what you're going through.
When I first started, everything was geared towards the patient surviving. Now, care is not only geared towards the patient surviving, but also mitigating the effects of our therapy so that in their survivorship, they have a good, if not excellent, quality of life.